Thank you for having me here. I appreciate everyone attending today. So let's go ahead and jump right in and let's quickly define what are upskilling and reskilling. So the common definition of upskilling is when employers provide employees with more advanced skills through additional education and training with the goals of improving the efficiency and effectiveness of an organization. Upskilling essentially allows an employer to take advantage of resources that are already existing within the current workforce with minimal amount of disruption across different departments. Whereas reskilling is defined as training for employees who have shown they have the aptitude for learning a completely new role or even an occupation. Now, in a reskilling initiative, workers receive new training, experiences, and certifications that allow them to move between different roles within the organization. And this provides both growth for the employee as well as a more versatile staff. We also see this making an impact by offering more flexibility with scheduling and backfilling needs. Additionally, it increases the capabilities of an organization to be prepared for future events, both planned and unplanned, as we've observed with COVID. So according to the World Economic Forum, approximately 54% of workers will need to be reskilled or upskilled in the next 3 years. The employees themselves tend to agree, and there was a survey that was conducted by West Monroe Partners that found that 60% of employees believe that their current skill set will become outdated in the next 3 to 5 years. So this really shouldn't be a surprise for most people. For current and future healthcare professionals, especially those in entry-level positions or early in their careers, this means capitalizing on upskilling and reskilling. There's also certificate stacking opportunities here as well. These education and training options are relatively fast and affordable for both the employers and the employees. They also increase upward mobility potential and make it easier to fill staffing voids. And last but certainly not least, it can improve salary potential for employees. So which we can all agree that improved salary potential for employees is always a motivator. And for employers, it means keeping well-trained professionals on staff, encouraging employee loyalty, and ultimately improving patient care. This enables employers to be better prepared for both known and unknown disruptions. It increases the personnel availability and versatility when it comes to staffing and scheduling. And additionally, we all know that increasing skills may also increase the effectiveness of an organization. So let's take a moment and let's dive a little bit deeper. A skills gap can cost employers significantly in the workplace errors, accidents, as well as compliance violations. The impact of this is felt in many industries, but really none more than healthcare. By expanding individual employee skill sets, your business can create a more rounded, more interchangeable workforce. Now that helps you avoid scheduling pitfalls that may arise when there's not enough workers with the necessary skills available. Especially in heavily regulated industries such as healthcare, a shortage of skilled or certified workers can lead to heavy fines and penalties. Having multiple employees in your workforce who are fully credentialed and certified to perform certain tasks and operate equipment and abide by industry guidelines, this helps avoid compliance violations while also maintaining higher standards of safety and quality. Another major consideration for employers in high turnover industries such as healthcare is that it's proven that in most cases, it costs an organization significantly less to keep existing employees than it would be to either go back out and recruit and hire and train a new one. Upskilling and reskilling help improve employee retention rates by keeping workers more engaged, thus giving them tangible goals as well as an advancement path to work towards. Now, we'll take a quick look at a case study. Now, I'll tell you in this particular case study, we're not going to be using the real names of the people. or the names of their organization. However, we will walk you through a story of how one healthcare organization was able to expand the staff skills and create defined learning paths which would help them grow and better prepare for the future. So on this slide here, we have Caitlin. So meet Caitlin. She's the nursing manager, we'll say, East General Hospital. After the initial COVID wave, she conducted an efficiency review of her staffing needs and skills. Now, while Caitlin encourages her staff to explore additional related skills, she also wants to ensure that the department has a unified plan. And in this case, with a case study, we'll delve into some of the topics relating to learning management and how Caitlin was able to leverage the tools around her to accomplish her goal. The result of this evaluation concluded that staff skills must be expanded in preparation for the next 5-year forecast. This includes establishing both team as well as individual learning paths. So based on this report, Caitlin actually had created 3 goals. First was to identify and benchmark employee skills. Second was based on this review, Caitlin realized an employee upskilling and reskilling plan needed to be created. It was clear. The employees would be encouraged to complete learning paths to close any skills gap that were identified during the review. And third, in order to reduce time and effort, the plan would need to have a high level of automation since her department consists of, I believe it was 120 nurses. So Caitlin's first goal was to review the employee skills. This included both the team and the individual skills as well as the certifications. These skills had been predefined back in 2019 and they were integrated within learning plans at that time. Additionally, they were documented in the HRIS system and shared with the organization's learning management system. And in this particular case, the LMS was Adobe Captivate Prime. For each role, there was a clear description of necessary duties. Next, those duties were then broken down into skills essential for each employee to complete their job. For example, when a particular role demands a high level of contact with patients, it was identified that things like communication and customer service skills, those were vital for those individuals that were hired to fill those positions. Now, after assessing what skills were needed, they were prioritized to determine which were essential to be successful in the role immediately versus those that could be developed over time. So this analysis enabled Caitlin to review the day-to-day skills necessary to run her department. It also helped identify any vulnerabilities related to the certifications. Now, once the department had a list of skills to work from, they could start investigating whether the staff had these skills and at what level. It was important to stay true to the appraisal and to validate through assessment and observation. It's easy to assume that, a person with a nursing certificate has basic problem-solving skills, for example, or a lab tech with 15 years of experience has expert level knowledge of their job. But in this particular situation, it was crucial not to assume. The core skills within nursing are the result of education as well as experience. However, it's important not to assume an employee still possesses the skills they had when they earned their certificate 15 or 20 years ago. It's essential to clearly define and catalog these skills that are needed and then compare them to what the staff currently possesses. And that's done through assessments, simulations, and other methods of benchmarking. So for this demonstration, we're going to go ahead and identify the employee's skills. We'll be using Adobe Captivate Prime to illustrate how these skills are viewed. Ashley will take us through the manager dashboard in Prime to look at the feature that allows Caitlin to view the team skills that have been completed and be able to provide some forecasting. So Ashley, I'll hand this over to you.
Perfect. Thanks, Rob. I'm going to pull up my screen with Captivate Prime. And for reference, Captivate Prime is browser-based, so we can access the platform 24/7 on any device across browsers as well. And there is an available mobile application for Captivate Prime. Now, as discussed, we're focusing in on the manager dashboard here in Captivate Prime. So as our nurse practitioner manager here at East General Hospital, Caitlin Gould, we're currently signed into the manager role where we can view our existing team, the enrollments, views, and completions across our team, and keep track of our compliance dashboard so that we can ensure that all of our nurses have completed the proper courses so far. And we have the compliance dashboard showcasing in an array of colors 0 to 100% fully compliant learners based on the learnings that we would like to show on the dashboard. Now, focusing in on our skills, Captivate Prime is a skill-based learning management system. So the idea there, not just to provide one-off trainings, rather to set learners on a correct path for achieving all of the skills that they'll need in their arsenal to complete their day-to-day tasks. Now, our graph here at the top is going to show our skill status and the percentage of learners in each skill. So we've got, for example, to establish a baseline, as we were discussing, we can have a general level of expertise where we administered an assessment to our group of nurses and kind of set the baseline for what their general skill level is. So this was perhaps sort of an elemental basic nurse training course, and we wanted to establish a foundation for what our personnel already knows so that we can then assess what sort of skills will be required in subsequent trainings for the purposes of upskilling. So in our skill status here, currently we're showing 14 skills, and we can adjust this to show whatever skills we're looking to assess here. So we can then factor in, perhaps if we've already created our subsequent nurse practitioner training, we can factor those in here and basically adjust all of these reports to show on screen the skills that we're looking to track. In order to get a better idea not only of the skills that were already achieved, as we can see in this chart, in progress versus achieved, we can also refer to the skills tracker. And the skills tracker will show the skill level completion forecast. So we'll see, of course, on the y-axis, the team completion in percentage, and on the x-axis, we'll see our date, so we can get an accurate forecast of when we anticipate users to have completed specific trainings, which again, we can account for different skills here. So we might want to adapt that to showing beyond our general. Let's add in some of our upcoming nursing courses that we've designed to upskill our nurses beyond the general training that we've already assessed that they have. So now we can focus in on those particular skills as well and get a good idea of maybe what has already been completed. For example, this particular course, Nursing 101, the deadline was August 31st. So we'll have total completion because our learners have completed that course already. And then we can start to factor in other skills as well. So if we take a look at maybe our next upcoming course after Nursing 101, naturally Nursing 102 here, we can account for the forecast on that particular course as well. So you'll see the graph immediately update. And this particular course, Nursing 102, is to be administered directly after Nursing 101 with our completion deadline that was today at the end of the month. So nurses are expected in this example scenario to have completed Nursing 101 and immediately thereafter fall into course for Nursing 102, which has a deadline of September 30th. Now, right now, all of our nurses have already been enrolled into Nursing 102, so we're projecting based on 100% completion on previous courses and based on what we want to account for target completion 100% by target date September 30th, which is our deadline, we can get ideally an accurate forecast of what that's going to look like if everyone follows the deadline and we follow our proper protocol, which, as we'll see later on, we can automate within Captivate Prime through a number of different learning programs, certifications, and learning plans to make the process easier so that users can follow a custom learning path that will address all the skills that we want them to achieve. Now, another good way to look at this information is through the specific reports here in our dashboard. So we can create different dashboards and compile different reports in order to better organize them. So right now we've got a custom dashboard for our nurse practitioner training where we can see individual reports for nurse practitioner course 101, 102, and 103. So we'll be able to see, for example, each of our courses, 102, 101, 103, has 3 levels that we'd like our nurses to get through. So we can see, for example, in Nurse Practitioner Course 101, all of our users have been assigned this skill to complete. And everybody so far has completed that initial elemental level that we wanted them to complete, which is level 1 of Nurse Practitioner 101. So we can see down here on our bar graph, skills assigned versus skills achieved in the appropriate colors. So we can funnel in and we can see that all of our nurses so far have completed Nurse Practitioner Course 101, Level 1 by our targeted date. And we can see that everybody else, or everybody is also enrolled in these other courses 102 and 103, so that they are targeted to achieve those skills as well. And so far, from skill level 1 to 3 on those individual courses, all of our users are enrolled but have not yet achieved those skills, but the deadlines have not arrived yet, so we are still on target. So with that, let's head back into our content. And Rob, I'm going to pass it back to you to discuss a little bit more and continue on here, and then we'll head back into Captivate Prime so we can see how to specifically enroll our users and create those specific programs and certifications that can help us further automate these learning paths.
Hey, that's great, Ashley. Thanks. That's a really great tool for reporting and forecasting. I'm curious how everyone here reviews their skills of their staff. And we actually put a few questions together. Let me get up to that point. There we are. And, like for everyone here to take an opportunity to provide some feedback, curious how, are learning skills intertwined within your organization? What sort of methods are you currently using to assess the skills? And are you tracking both the technical and personal skills of the teams too? So some good responses here. Really helpful. Hey, that's great. That's great. Okay. So it looks like a little bit of mix. Let's see, not tracking specific skills in the management system. Looks like there's multiple methods that are being used to assess the skills, so that's great. And as far as trying to track both technical and personal skills, it sounds like they might be a little siloed in some of those areas. So that's great. Thanks. That's good feedback. Really appreciate it. Let's go ahead and move on to the next step here. Now, as far as working with Caitlin and encouraging her employee upskills, Caitlin's second goal was just that, to encourage her employees to upskill. Now, upskilling now ranks among the most significant trends in healthcare. Research conducted in 2019 by PricewaterhouseCoopers determined that now is the time to invest in increasing the healthcare workforce efficiency and productivity. And this ensures that they can compete at the top of their abilities and licenses. Now, providers that don't make those investments may have some challenges competing effectively in this changing market and will encounter some possibly some major obstacles for growth. Now, when a new set of skills is being introduced in the industry, such as we've seen with the initial COVID wave, it further reinforces the need to upskill the staff. So as a nursing manager, Caitlin's upskilling goals included to clearly understand the skills currently available within the team, to outline the compliances needed to effectively operate the team, and identify team members who can fill in for future gaps. Now, when identifying skills and compliances needed for a fully functional team, the managers, they need to clearly define both the team as well as the individual skill paths required to ensure that the department is, well, future-proof. And managers need to work with individuals on defining their role within the team. So once you have clearly identified the skills and certifications needed within the team, it's important to transfer those benchmarks to your learning management platform. Skills should be mapped to each role and progression paths should be identified. Next, Ashley will take us through the process of how Caitlin could enroll her employees into courses, as well as more complex programs and certifications. So Ashley, I'll hand this over to you.
Excellent, thanks Rob. Moving back into Captivate Prime, we're going to switch Caitlin into our admin role here. And you'll see there are a number of different roles that we can assume within Captivate Prime that will dictate the responsibilities that we have on hand in order to fulfill. So through the admin role, we'll be able to see the expanse of our skill-based learning platform elements. So you'll see down at the bottom here, we have added the appropriate skills to correspond with nursing levels 101, 102, 103 as sort of our initial upskilling path for all of our employees. And you'll note here we can adjust the levels that go into each one of these skills. So under each skill, we can have a degree of levels that users can earn in order to be thoroughly qualified within that skill. Now skills, it's up to us what we dictate to be the skill that the learner will earn through any given course. So beyond our three-tiered learning courses here for nursing, we can expand into sort of lab testing, we can expand into bedside manner, we can do specific courses for x-raying or for taking vitals. So the skills are up to us, and we can dictate what those are here by creating a skill within the admin role. So very easy to do that, and it's designed to correspond with the course that we're administering. And we can also determine how many credits from each level course will be required to proficiently earn that skill. Once these skills are established, when we create our courses through the author role, we can tie each of our individual courses to our particular skill. So we'll see here, each of our courses right in here already configured is tied to a particular skill, this one corresponding to Nursing 101, Level 1, and the user will earn that specific level of that skill upon completing that course. So in order to enroll our users, we can, within Captivate Prime, have a manager-approved or manager-nominated based system in order to enroll learners. And we can also have a self-enrollment format where users are able to find specific courses in a catalog that might be tailored specifically for them. So we could create a catalog that is tailored for nurse practitioners, and then users would be able to see those appropriate courses or be enrolled in them by an admin or a manager in order to take the appropriate courses for their training. Now within our users category, we also have the capability to create user groups. So if we'd like a straightforward and streamlined way to set up all of our users and enroll them in a course, we can create a custom group. So I've created one here for our nurse practitioners. And that way, instead of enrolling all of our 120 users in a specific course one by one, I have them all in a particular group under nurse practitioners. And when I go to enroll them in a course, instead of, again, doing that one by one, which can get quite tedious, I can instead enroll that entire group, and it will place everybody into that course. A lot of these groups are also created automatically. So for example, if we refer to Caitlin Gould's team here at East General Hospital, we'll be able to see the team members under her purview, and that would be another way in which we could enroll users into courses. So going into the course itself, once our courses are created through the admin role, you'll note that we have a number of different settings that we can adjust here, one of which would be very useful to us in course enrollment, especially if it's a course that we wish to deliver to possibly multiple groups or re-administer. We can leverage the instances function within Captivate Prime that would allow us to simply refresh a course instead of recreating it from scratch. So that way, if we have another batch of nurses that needs to take Nursing 101, instead of recreating the course from scratch, we can simply add a new instance where we would enter an instance title and then pick a completion date. And once we save that, we can go through and enroll our learners. So the enrollment process, as we discussed, can be one by one where we search for users, or it could be in one fell swoop where we enroll our whole nurse practitioners group, or even a profile associated with that user. So all 120 of Caitlin Gould's nurse practitioner users here in Captivate Prime are under the profile nurse practitioner, so that we can also go by profile as well. So this is a very easy way to enroll our learners here. And again, all of the instances that we create here can be saved. So we'll have them available to us for reference if we ever need to refer to the stats that learners have earned, the course completion statistics. We'll have all of that information tracked within here. So that will be tied along to all of the users that have been enrolled in a course. Each user, in turn, will sign into our Captivate Prime platform, which, as you'll see here, is branded as well. This particular account here has been branded for our East General Hospital here, so we can create our own subdomain as well, where users will be able to save that, for example, if they'd like, to their browser, simply sign in where they will be signed in as a learner, and they can come in here to take the necessary courses that have been assigned to them, which will appear in their learning list. Great, so Rob, I'm going to go ahead and pass it back to you. We've got a little bit more info to cover before we come back to Captivate Prime again as well, to look at how the test scores work and how learning plans work as well.
Hey, that's great, Ashley. Thank you. You make it look so easy as well. So that's great. I personally like the grouping availability within Prime to help organize the individuals that are going to be registered for these courses as well. So I think that's fantastic. So yeah, let's go ahead and take a quick look at beyond this. And I had a couple questions here in regards to, is your organization implementing an upskill plan? Is this actively happening within the organizations? And also, what methods are you using for the upskilling? We have formal training. There are definitely certifications available. I know mentoring, shadowing is quite popular as well. In talking with Caitlin, self-training, there's a ton of self-training available out there as well. So it seems like a good mix of all that seems to be kind of the right recipe for many organizations. So that's fantastic. Well, thank you very much for sharing with that. And with that, we'll go back to the presentation here and just finish up on what Caitlin's third goal here was. Now, Caitlin's third goal was to automate the process and save her and the staff valuable time, right? She also wanted to make sure that the process was simple and clear for everyone involved. Now, her first step of this goal was to identify how her staff were performing and to create a bench, a benchmark or a baseline for the automation of the learning path. And she wanted to learn key factors such as what were the average scores and were there any clear indicators that certain topics just frankly weren't resonating with the team. Her next step was to identify any obstacles that would prevent the team from learning. So as we looked back during the survey, there was a mix of self-paced and mentoring and more formalized training. She had to make sure that the training did not conflict with the scheduling. Self-paced learning would be optimal in many cases as long as it's effective in meeting the objectives. Otherwise, hands-on training was necessary, whether that was virtual, whether that was in-person in class, classroom, or mentoring. She also wanted to incorporate mentoring in a deeper level to enable the staff to share and discuss how they were doing through the process. I mean, that feedback was really important for her to receive on a regular basis, and she wanted a vehicle in place for the staff to submit questions and examples of their performance. So the environment needed to be easy to navigate for both her nursing, and her management staff. And finally, she wanted to clearly define these learning plans, which aligned with the upskilling goals. The plans needed to account for how the staff performed in their assessments, and it would determine which is the next logical step for them to take in their paths. So Caitlin needed to create a baseline for testing and other measured activities. So Ashley, would you show how Caitlin documented some of the test scores and the learning plans? And I'll hand this over to you.
Definitely. All right, so we discussed the usefulness of automating all of these different course components in the form of certifications, learning plans, and learning programs so that we can create an effective learning path and strategy moving forward. And all of that will in turn be tracked automatically by Captivate Prime, our LMS. So if we head into either the administrator role or the manager role, we'll be able to view a series of reports that we can customize. There are hundreds of custom reports that we can create here within Captivate Prime. And we viewed our dashboard earlier, our nurse practitioner dashboard here. So we'll be able to see our skills specifically, or we can head into specific reports for different courses. So we can access those through the Reports tab or through the individual course page. So if we go into Nursing 101 back here, we'll be able to take a look at our L2 quiz score feedback. So let's refer to the users that have already taken this course, for example. Now we have on screen, for since this is an example, we've got a smaller sample size here, but we'll be able to see for each of our users the exact score that they got in this particular Nursing 101 course that had a quiz associated with it. We'll be able to see this information in points or percentages, and we also get this really nice by question view where we're able to see exactly what the question was at hand. So for example, we had a five question series here, starting with number 1, what are the signs of a concussion? Select all that apply, and ending with what does PE stand for in medical terms? So we had a number of different questions here, and we can expand this view as well. So I like to resize it sometimes, especially for a better view. So again, ending here, what does PE stand for in a medical context? And we'll be able to see for each of these questions, if we hover over them, we can see the number of users that got this question correct versus incorrect. So we see most of our nurses got all of these questions correct, except for question 3 here, I guess question 2 actually. First page is our title page. What is a better pain reliever option for a patient with open wounds? So we had most of our nurses getting that correct, but definitely perhaps something that we'd want to make sure that all of our nurses are aware of. And within here, we are able to funnel in and export all of this information. So if we need to, maybe it's an important bit of information, if we need to talk to any one of our personnel here, make sure that that information is covered, we'll be able to see exactly who answered what to each question. So this by question view in the reports section for each of our courses, specifically the quiz score section, will give us a really detailed view of all of the content that is in here. Now, as far as setting a learning path moving forward, we've got 3 main elements beyond courses that can help us automate this process. Starting under courses, we've got our learning programs category, where we are able to compile a series of courses in order to create a longer term program. So rather than administering a course one by one and having to manually enroll all of our users when the time comes, we can set up a longer learning program that will allow us to compile all of those courses into one place, and it will allow us to dictate how these courses are completed. So for example, in this scenario, we might indicate that we would like the sequencing of our courses to be in order, which of course makes sense here because ideally our course and our upskilling will build on top of each other. In this case, that of course makes sense with our nursing courses that we've established. We obviously want our participants to complete Nursing 101 before they complete Nursing 102 and 103. So we can set that structure right in here and adjust what courses need to be featured in our learning program. Just like with courses, our learning programs can contain multiple instances. So if we need to re-administer this program, or if we need to keep tally, add new users, retrain old users, instead of recreating the entire learning program, we can simply add in a new instance, and then we can get a sense for our attendance and scoring. Because another nice part about Captivate Prime is that it allows us to create blended training, where we have not only self-paced, for example, we took a look at quizzes that we can administer that are built from a content authoring tool. And we can also set up in-person or virtual sessions. So if we do require nurses to kind of have hands-on experience within the hospital and provide that as part of the training, we can also set attendance and scoring for live elements as well to track whether a user attended their proper hospital hours and possibly score them based on different criteria. Again, how effectively they're administering vitals, how effective their bedside manner, how effective their report-taking skills are to document the patient's situation. Quiz scores can also be seen in the program, so a lot of the same information that we see on a course level will translate over to the program level as well. But again, the program level allows us to build a whole learning journey and compile courses into one central location, which can span a longer amount of time. Our certifications can be built within Captivate Prime, or they can be exported from elsewhere. So in our scenario, Caitlin Gould here at East General Hospital had also previous information that she wanted to migrate over to Captivate Prime about past certifications. So that information can be migrated, it can be imported into the system, and we can also use our existing courses in order to create a new certification. So our certification will be built sort of like the learning program, where we have our different courses compiled into the certification. And the certification will allow us to adjust it to be recurring or perpetual. So as we discussed toward the beginning of our session here, nurses might have taken, a lab tech certification or initial certification perhaps 15 years ago, and a good refresher can always be warranted. So we might set our certification to be recurring, maybe yearly. So in this case, this particular certification has 3 courses that we discussed, each of which we allot 1 month to complete. So we're going to give users about 180 days. I suppose we should take it down to 90 days if we want to stick to that strict deadline. So we can always come back and edit this. put in our time frame there so that we span 3 months and set a firm deadline. And this particular certification we might set as recurring because we want our personnel to come back and retake it to make sure that their base skills are still up to par. With that, we can automate reassignment of this, either based on the completion date or based on the enrollment date. So that's where the validity comes in here. So this particular certification, we might state that it's valid for 12 months, so the whole year. And after the year, based on either the completion date or the enrollment date, we can have Captivate Prime automatically re-enroll all of our nurses into this particular certification, which again, they would complete in order because each of the courses builds upon one another. This section here, the certification issuer, will allow us to indicate whether we're administering the certification or whether it's an external certification that we're bringing in here. So this portion can be adjusted as well. Like with our program and our courses, we have our attendance and scoring section and our quiz scores. And this particular certification, let's see, none of our nurses have taken this one here, but we have all of our stats in our by course report that we saw earlier. So here we can see our tally of certifications. So we've got our nurse practitioner certification. We also have our lab tech certification here. So we can expand upon these. And again, all of this is designed to be a reflection of whatever skills we're looking to pass on to users and whatever we're looking to test for. Now finally, in the process of automation, we have our learning plan. And our learning plan is going to differ mainly from the learning program and the certification in that it allows us to automatically assign courses based on particular events or occurrences. So this could be the addition of a new employee into the system. Maybe we automatically enroll them into that general course that we were seeing on the manager dashboard earlier. Maybe we automatically enroll them into our nurse practitioner program. But when we add a particular learning program, we'll be able to see all of this information there and edit the occurrence situation. So let's create a new one for reference so we can see what our options are here. So we're going to title this one similarly. Now we'll see our options here. This particular learning plan can be administered to a group when a new learner is added to the system, when they get added to a particular group, so possibly when our learners are funneled into the nurse practitioner group, when they get removed to a group, when they complete a training. The one that I like as well that's good for this scenario is when they achieve a skill level, or we could even have it on a specific date if there are certain courses that need to be completed to maybe adhere to different compliances, maybe some degree of fire training or fire safety training, some CPR training that must be completed perhaps before their start date, and we have users starting in batches. So this can be customized every which way. And one of the ones that will adhere to our example here that we've created for Caitlin Gould at East General Hospital is the upskill scenario. So in this scenario, we could indicate that nurses will automatically be enrolled in Nursing 102 after they have completed Nursing 101, maybe just level 1, or ideally in this case, we'd want them to complete all levels. So we could say after they complete up to level 3 of Nursing 101, they will be enrolled in Nursing 102. So the action could be to enroll to training, but it could also be to unenroll from training or even add the user to a custom group. Like we could enroll them into already skilled nurse practitioner group versus in training nurse practitioner group. So there's many ways that we could organize this, but as Rob was mentioning earlier, the key is to evaluate the objectives, evaluate the skills that need to be completed, how we would like to go about training for those, and what we want to see happen in the future in terms of a learning path, how we want that to be organized. So this particular selected training, this is going to happen automatically, and we can decide what instance they're going to be enrolled in. and how much time they have to complete it after assignment. Now, this training could be enrolled, or these users could be enrolled in this training immediately upon completing the previous training, or we can give them a few days as buffer. Possibly they might also have to take another exam or complete in-person hospital training in between that time. So we might give a buffer of a certain number of days, or we can just tie our courses one to the other in rapid succession here. So the learning plan certainly serves to automate, which again is going to allow us to create that chain of reaction so that it becomes easier to enroll all of our users in that learning path. As individual managers within the system, we don't necessarily have to manually keep track of everything. We don't have to, write anything down or set reminders. Rather, we can have the system automatically take care of a lot of these items for us so that we make sure that all of our learners are appropriately scheduled for the right training at the right time and set on a path for success. Perfect. Okay, so Rob, I'm going to go ahead and pass it back to you.
Yeah, that's great. That's great. The learning pass portion of that is probably the most impactful aspect of creating these upskilling and reskilling plans. And having that completely automated makes a huge difference, saves a ton of time, and as well as helps keep everything organized. So definitely what we're looking for in these cases. Now, this is basically how Caitlin's department was able to create a baseline and successfully completing the tests and the other measured activities. So in talking with Caitlin, I listed 10 key steps that were followed during her upskilling and reskilling of the department. And first was to create a department-wide review, and this can identify key roles required for an effective department. Every role needs benchmark skills and certifications. And by listing the critical capabilities of the employees, that what they'll need, you can identify future skills while assessing the current skills through self-paced and demonstration activities. And when you're setting the goals, base them on the skills gap. This encourages the upskilling. This is where you see the needle moving. And aligning these skills within the learning platform, as we saw a minute ago, utilize that platform and construct a map towards gaining the skills and measuring the progress. Doing this will allow both you and your learners to match the skills for future opportunities. They're going to be equally as focused on growth at that point in time as well, because it'll be a clear path that they'll be able to see. And lastly, communicate the metrics of your success. Explain what was done and how you got to that endpoint. So training your team and giving them this opportunity will empower the business and establishes an adaptable workforce, as well as prepares you and the entire staff for inevitable change. So Ashley, this was great. Thank you very much for sharing the demonstrations on Prime. At this point in time, yeah, no, it was awesome. It was really great. So, at this point in time, if anyone had any questions, be happy to answer them. I think we had a lot of great feedback also in the polls earlier today. So if anyone wanted to expand on that too, I'll be happy to answer them. I'll leave it here.
All right, I can take back over. Thank you again, Rob and Ashley, and thank you, everybody. It looks like we have time to answer some questions. So like Rob said, if you have any questions, feel free to submit them by using the Q&A pod on the left side of your screen now. The first question we have is, how long did it take the department to get everyone upskilled?
Okay, so that's a great question. So 120 nurses establishing the gap analysis had identified that there was a moderate gap in there, and definitely within because of some of the factors that COVID had presented, some new challenges, it enabled them to go ahead and really push forward. Now, they had to do it during the pandemic also, which took some time. But for her case, it was about close to, I think they're almost done. So about a year and a half into this for the complete upskilling. And I think there's still a little bit more to be done. But I think that that was the goal. Now her goal was over a 3-year period, so I think that she's definitely going to be able to accomplish that within that time frame. So,
all right, and we have another question. How did they handle in-person training?
Okay,
Sure.
All right, yeah. So in-person training. Ashley, do you want to answer that or?
Yeah, absolutely. So in-person training can actually also be tracked through Captivate Prime, and there are two types of training kind of that fall under that degree: the actual in-person physical training, but also virtual training that can be administered. So of course we had kind of our full-on COVID wave where everything slowed down a little bit, but of course nurses still had to be present where not everybody necessarily had to. So as far as in-person training, that can be tracked within the learning management system within Prime through the in-person training module that can be added into a course, which allows also for both attendance and scoring. So there is an option within a course, like we saw the quiz report, there is an option for managers and instructors to mark off a user having attended. So let's say they had in-person hospital training or in-person hospital hours that they had to fulfill. That can all be handled within Captivate Prime. Again, tracking attendance, simply marking off that the nurse in question was present for the appropriate number of hours. And there is an optional scoring element that could be applied as well. So again, if we were having to score nurses on bedside manner or taking vitals or jotting down the proper information within their charts, how effectively they did all of those above or other categories, there is another element within the in-person training module that allows for managers, instructors to put in a score. So we would actually have a point value assigned to that as well. So that would fall under the blended training category, whereas we can also administer just self-paced training with information and quizzing. If we want to incorporate in-person into a course, it would become a blended module that would allow us to track it in the system as well.
Great, thank you, Ashley. We have a third question. You mentioned the nurses could submit their work to the LMS. What did you mean, and how does that work?
I'll take this one. As far as submitting their work to the LMS, so there was some instances in which that the nurses had to present certain techniques, and with today's technology, the nurses were able to video themselves, using their phone and submitting that. And actually, as far as that goes, I can show you a little bit. Actually, if you'll transition me over to a demonstration, I'll go ahead and show you just real quick how that works. All right. Great. Okay. So are you all seeing my screen here? The Captivate Prime screen? Fantastic. Okay. So in this particular one, I'm just using this emergency preparedness course. So for example, we could go ahead and add additional modules as activity modules for the nurses. And those nurses could submit, maybe it's a bandaging process or something, provide a description. But in here, they could go ahead and submit a video to specific instructors, and Caitlin's manager group could be designated those instructors. So for example, I'll put myself in here as the instructor, but there could be multiple instructors evaluating these techniques. And the expectation is that how long it would take them to complete those activities. Now, those would be part of that. And as an instructor, someone that's evaluating that instructor would be allowed to go ahead and take a look at the submissions that are being presented. The learners would be able to video themselves, submit a copy of the video to the course itself, and the designated instructors would be able to evaluate and provide grading and comments based on that activity. So that was a really great way that they could go ahead and demonstrate some of these hands-on activities, and the nurses were able to do this at their own on their own schedule as well. So that was something that was very helpful. So I'll go ahead and return back. So thank you.